Hello, welcome to my channel. This is Dr. Emmanuel. And as you can see on my screen, this is the 14Fish portfolio for GP trainees in the United Kingdom. And the reason I've decided to do this video is because I've seen that so many of us who are GP trainees struggle a lot with our portfolio entries, okay? Especially people who, I wouldn't say especially, I think everyone actually, but even both the immigrants and people who trained in the UK, I've come across people who really struggle with the portfolio. So I've decided to just put a few things together for us to just look at what the portfolio entries are like. And this is especially targeted at people who are just starting off with GP training, because that's usually when so many people feel, they feel like they've not really had that proper orientation, portfolio wise to know exactly what is expected of them. And if they feel like they've not really got that guidance on how to go about putting things into their GP portfolio. So I've just put in a few things and I've made efforts to make sure that there's no patient identifiable information and there's no colleague identifiable information. So I've blurred out things like the names of my supervisors and some of those things, okay? So let's move. So when you log into your 14Fish portfolio, and when you click on the portfolio part, you will see something like this, okay? So your dashboard will look like this. Okay, it looks really crowded because it's quite constricted. I've just copied and pasted. So you see from what looks like this. You see your learning logs. Okay, you see your ESR preparation. ESR means Educational Supervisor Review. You see your educational assessments. You see your clinical examination and procedural skills, which are called CEPS. You see things like these settings, your review period, when your next annual review of, competencies is due, what level is your ST1, that's first year, second year, or third year, when your CCT, which is your completion of training dates, your deanery, and all of that, the name of your supervisor will all be there, your PDPs, which are your personal development plans, usually something simple. You can see here I've put history taking / assessment of depression to improve on assessment and treatment of anxiety disorders, mental capacity assessments, gaining more competence in assessment of bipolar disorder. So I'm currently doing my psychiatry rotation. So you can see that my personal development plans are tailored towards improving my skills, both history taking, physical examination, mental state examination in psychiatry. Previous action plans, I had the plan of doing the diploma in Royal College, which I passed, and some other previous things. So it also shows you exams that you've booked, or if you've passed the exams. It's also so the AKT, the clinical skill assessment. It says no exam booked. The recorded consultation assessments, no exam booked, because I'll be doing either of those in my last year of training ST3. Multi-source feedback. So this is what your dashboard will look like when you click on the portfolio aspects. Okay. And then I've just cropped these for us to look at what the requirements are like. It's quite intense because obviously working in the NHS is really busy. You have so many patients, you have a lot to do when you're on your placement. So trying to make out time to reflect on the things you've done at work, can also be quite cumbersome and physically and mentally, stressful at times. So, but you need to know what is expected of you because you need to do these things for you to progress in your training. Okay. So clinical case reviews, you need 108 in total minimum. You need 36 clinical case reviews in your ST1. You need 32 in your ST2. And then you need to pick it up to 108 in your ST3. We'll still look at another page. You need your Mini-CEX, okay? Mini-CEX or consultation observed tool, which means what it means is you're consulting or you're reviewing a patient and someone is observing you or supervising. Someone is just watching you take a history, for instance, watching you perform a physical examination, how you relate to the patient, and then you send them something for them to complete on your portfolio, saying, ranking your assessments if you're meeting the required standard, okay, for your training at that level. And then your case-based discussions, your CBDs, you need 2 CBDs every 6 months in your ST1. So usually, it depends on your deanery. My deanery ST1 usually is divided into 2 parts, each of which is 6 months. And so you will need to do 18, you need to do two mini-CEXs, two CBDs in each 6 months, or you need 4 in 1 year. So 4 mini-CEXs, 4 CBDs in your first year of training, same thing as your second year of training. We'll still look at what it entails in the third year of training, because I haven't yet got into my ST3, but then I think I have a slide where we'll look at ST3 requirements. Colleague feedback, you need to do colleague feedback, which is also called multi-source feedback, once in your ST1 and once in your ST2, okay? And you also do that once in your ST3, because in your total, in all, you need 3 colleague feedbacks, okay? And then you can choose, you also need to do colleague feedback as regards leadership only in ST3. You can see in ST1, you don't need to do your leadership feedback. You don't need to do leadership feedback in ST2, but in ST3, you will need to do 1. At the end of each clinical rotation, especially if it's in the hospital, you do a clinical supervisor review. Okay, so if in your ST1 you have 1 hospital rotation, you will need to do 1 clinical supervisor review. So each time you do a hospital rotation, you do a clinical supervisor review. For your GP placements, you don't need a clinical supervisor review, because usually your educational supervisor would be in your GP, wherever you're doing your GP placements. So patient feedback is only done in ST3. In ST1 and ST2, you don't need to do patient feedback. If you do it, it doesn't count. So try to channel your efforts towards meeting the portfolio requirements, such that in ST1, there's really no point doing a patient feedback in ST1, because it doesn't really count towards your portfolio progress. You rather channel that efforts and time into doing something that's is in keeping with your ST1 requirements, because believe you me, you wouldn't have time for everything. So channel your efforts into meeting the requirements for that particular level. Placement planning meeting is a meeting you do with either your clinical supervisor or your educational supervisor at the beginning of. Usually you do it with your educational supervisor, actually. It's advised. You do it at the beginning of every placement, either GP placement or hospital placement. You do this meeting, very brief meeting, have a chat with your supervisor. Both of you agree on things that you hope to achieve during that placement. Learning event analysis, you should do 1 learning event analysis once every year, at least 1 a year. In ST2, I was able to do 2. Not sure why I did 2. ST2, I've been able to do how many? I've done 2 already. But if you look here, the denominator, if you look at this total, the denominator tells you the total you need to have in 3 years. So placement management, you need 3, which means 1 every year. Learning event analysis, you need 3, which means 1 every year. And learning event analysis simply means, maybe you've made a mistake personally, or maybe a colleague of yours made a mistake, and as a group, as a department, as a unit, as a practice, you people were able to talk about it, analyze or discuss, why did this happen? What could have been done to prevent this? How can we prevent this from happening subsequently? So that's a learning event analysis. You have to add it to your portfolio. Just reflect on it. Say what happened. Say how you were involved. Say what you learned, and see how that is going to affect your practice going forward. Prescribing assessment, you don't need to do that in ST1. You don't need to do that in ST2. If you look here, the denominator, you have 1. So you need to do 1 in your ST3 for prescribing. Same as leadership. ST1, you don't need leadership. ST2, you don't need leadership assessment. In ST3, you need to do 1 portfolio entry on leadership. So learning logs, you see this on your portfolio. Clinical case reviews. So this is just my ST2. This is the second part of my ST2. So I'm in psychiatry now. Clinical case reviews. So far, I've done 15 clinical case reviews, and I need 18 because we say in a year we need 36. So previously, I did ops and gynae. I was able to do 18, and now I need to do another 18, and I'm running short because I've done just 15. I need 3 more. Okay. Supporting documentation, there's no ceiling. Okay, there's no specific target for CPDs, supporting documentation. So supporting documentation are things like when you do your GP meetings, when you do the VTS, the vocational training scheme, when you attend your VTS, if you think it was really helpful, you could reflect on it. If you do your personal studies, read hospital policies, you could reflect on that. And other things, if you do e-learnings, attend seminars, you can add all of that, teachings, they all form your CPD. Learning event analysis, yeah, I've been able to do one. Reflection on feedback, I did one based on the feedback I received from one of my supervisors. Leadership management and professionalism, not required at this level, so I haven't really, it's done in ST3, so I haven't put anything because I'm trying to channel my efforts towards meeting my current portfolio requirements. Because if I do this leadership in ST2, it's not going to count as leadership for my ST3. So I have to leave that till I get to ST3, then I'll channel that effort. Quality improvement activity, QIP. You need to do one QIP every year. So I've been able to do one this year. I did one in my ST1, and I'll have to do another one in ST3. Prescribing, I haven't done any entries, so 0 entries because I'm going to channel that effort to do my prescribing requirements in ST3. Okay. Placement planning meeting, 1 every placement. So in my psychiatry placement at the beginning, I had an entry, a meeting with my educational supervisor. Academic activity is usually for people who are academic trainees. So I'm a clinical GP trainee and not academic GP trainee. There's some people who are academic GP trainees and they have specific academic portfolio requirements for their training. This is another portion of our portfolio. So we can see here ESR preparation. So before your educational supervisor review, you need to click on your requirements. When you open your requirements, you see if you're meeting, if you've been able to achieve everything that you need. And when you go to prepare also helps you, see things that you need to sign off before your educational supervisor can complete that review. So capabilities, you can see there are 13 capabilities and there are 9 clinical experience groups. So we'll get to see what these capabilities look like and what they entail in subsequent slides. The action plans at the beginning of your training of each placement, you need to have at least 3 action plans, action plans can be tied to your PDP. So PDP is like the plan, personal development plan. And your action plans could be tied to your PDPs, like how you intend achieving those PDPs. Or you can also put exams. If you're going to do your AKT, if you're going to do exams that are GP related, you can add them under your action plans or your PDPs. Clinical experience group is something you need to just tick off before your educational supervisor review. You just click on these and you have to tick off that clinical experience group. Just tick that you've been able to capture all the clinical experience groups during your placement. Education assessment progress is something you also need to click and complete before your educational supervisor review. Health and probity are things you need to sign at the beginning of your training. At the beginning of each year, you just sign that you're physically fit. You're not having any health issue that can encumber your progress in your training. Probity, you have to just show that you haven't got any fitness to practice problems, that could encumber your progress as a trainee, as a safe doctor. So when it comes to capabilities, When it comes to capabilities, we go back a bit. So capabilities, you need to try to tick off all of these, okay? You can see that I've been able to tick off all of these. And how you do that? So we have communication and consultation skills. So when you're putting your portfolio entries, try to see, does it help? Were you able to communicate with the patient? Yes, consultation skills. We did apply some of the consultation skills, like, the golden minutes, being empathic and all of that, um, chunking and checking. So you just click there, you add consultation and communication skills, practicing holistically, promoting health and safeguarding. So if maybe while taking your history or reviewing a patient, you notice the patient was overweight and that was maybe causing their osteoarthritis or making it worse, and you were able to advise the patient to probably consider registering in the gym and losing some weight, that counts as practicing holistically and promoting health. If you told the patient, oh yeah, I think you should consider quitting smoking or cut down on your alcohol, that's promoting health. So you're promoting a patient's health. So that counts, that ticks off this capability. Working with colleagues and in teams, if you discuss with the pharmacist, if you discuss with your senior colleague, it counts as working with colleagues. Data gathering and interpretation, how you're able to, take your history, examination, how they guided, and even investigations, how they guided your decision making. Clinical examination and procedural skills, making a diagnosis or decision, clinical management, managing medical complexity, okay? Medical complexity is maybe a patient that was quite difficult, that had many needs or multiple comorbidities, and you had to consider several factors in deciding the best care for them. Organization and management and leadership, okay? Community orientation, you're able to realize maybe you refer the patient from the hospital to their GP, or you refer them to talk walks because, for talking therapy because they were depressed, and of course they agreed to be referred to talk walks. So your ability, your awareness of community-based services and the ability for you to use those services counts as community orientation. Maintaining performance, learning, and teaching. Usually you can see 17 because all of these come from teachings, VTS, e-learnings, they're all ways of maintaining your performance and learning. Maintaining an ethical approach. So if you provided a chaperone for a patient, for instance, if you assess the patient's mental capacity, a patient is declining a surgery. Surgery is the best form of treatment for their condition, but they're telling you, hey, no, I don't want to have a surgery, and they have mental capacity, and you're able to respect their decision. That's an ethical approach, okay? So you take that as maintaining an ethical approach. And then fitness to practice. Is there anything that could affect, that could have affected you providing the best possible care for your patients? Maybe you were hungry, you were tired, you weren't feeling very well. How were you able to manage that situation to ensure that it didn't lead to patient harm? So that comes under fitness to practice. Clinical experience groups. So we said there are 9 clinical experience groups. So 1, 2, 3, 4, 5, 6, 7, 8, 9. So infants, children, just say people less than 18, 19 years, for 18 years and below. If you worked with patients who are, 18 years and below, it counts as clinical, as infants, children, and young people. Sometimes, like if in psychiatry, depending on where you are, I'm currently in old people's mental health. So I've not seen any child. And ticking off this clinical experience group for me has been difficult in psychiatry because I haven't done children's psychiatry, and I wouldn't do children's psychiatry before my placement is over. So what I've been able to do is I've done some reading on childhood mental health conditions, 3 of those, and I've been able to use that to tick off this clinical experience group. Okay, I've used CPDs to complete these. So mental health, I'm currently in mental health, so you can see 27. If you're in A&E, you find that when you're in A&E, you'll be taking mostly urgent and unscheduled care. So it depends on where you are. When you're in Ops and Gynae, you'll be ticking off mostly gender, reproductive, and sexual health, okay? If you're in primary care, you might be ticking off things like mental health, because you see so many patients that have depression, anxiety. You might be taking off things like people with long-term conditions, mostly because when you're in the primary care placement, you see people with long-term conditions, hypertension, diabetes. But don't get carried away. Try to see how you can tick off everything. Okay? For instance, if you're in psychiatry, you mustn't put mental health in all of them. If, of course, all your patients have mental health problems, but you could see someone who has anxiety, depression, person has a cancer, okay? So rather than putting mental health, you could come there and tick people with long-term conditions, including cancer, okay? And then you could look for something else, maybe vulnerability. A person with cancer could, could be physically or emotionally being abused by a relative at home. So that might also count as safeguarding. Okay. Or that person with cancer, you might tell the person that, oh, I think you need to stop smoking. So that counts as population health and health promotion. Okay. So you see how you can just try to achieve everything using um, the patients you have. So irrespective of your placement, even if you're in pediatrics, you might find that it's difficult to tick off some things like chronic health, chronic conditions, because you're in pediatrics. You might not have so many patients with chronic conditions. So you can do CPDs. You can read up things, nice guidelines on the management of hypertension, for instance, and use it to tick off managing this. So this is educational assessments. We've said that in every placement, in every year, you need 4 CBDs. So if you're starting off as an ST1 GP trainee, depending on your depending on your deanery, some deaneries split their 12 months into 3. So 4 months, 4 months, 4 months. Some deaneries split it into 2, 6 months each. My deaneries, in my deanery, in the southwest of England, I think it depends. I think they're beginning to modify it, but for my own rotations, I did in ST1, I did 6 months of emergency medicine and 6 months of primary care GP placement. So CBD, clinic case-based discussion, in each 6 months, you need to do 2. So which means in a year, you'll be doing 4. The Mini-CEX I've not done any Mini-CEX yet in my psychiatry, so I'm lagging behind in that aspect. But I need 2 Mini-CEXs, and I already done 2 Mini-CEXs in obstetrics and gynecology. Okay, and I was able to do my quality improvement project, which is actually different from quality improvement activity, but we wouldn't be going into the difference in this video. So you need 1 QIP, only 1 QIP, quality improvement project, in your entire training. So you need just 1 QIP in your 3 years, but you need 3 QIAs, okay, in your 3 years. I think in the last VTS meeting I attended, I think the doctor said you can get away with having 1 QIP and 2 QIAs, okay, because sometimes it's difficult to do QIP and QIA in the same year. So you can do 1 QIP and 2 QIAs. I think that counts as satisfactory. And then prescribing is going to be done in ST3. And the clinical supervisor review, I'll have to do that before I can do my educational supervisor review in my psychiatry placement. These are CEPS, clinical examination and procedural skills, okay? You need to do so you have 1, 2, 3, 4, 5, 6. You got 6 procedures, and you just need to do 1 of each in your 3 years supervised, okay? Prostate examination, a registrar or a consultant or a GP can supervise you doing a prostate examination on a patient, and you send a portfolio ticket for them to complete that for you. Rectal examination, same thing, just 1 in 3 years supervised. Female genital bimanual, female genital speculum, breast examination, male genital examination. You just need to do 1 of each, being supervised by a senior colleague who would then sign it off for you. And you just need to do 1 of each in your 3 years of training. Compliance passports. These compliance passports here are very important. These are mandatory entries that you need to do every year. So they must be up to date every year. your code Form R and COVID declaration, you need to just, before each ESR, you just need to sign off this form to say, you know, things like if you had any complaints, if you had any problems, you know, with, you know, being referred, any legal issues, you know, or any complaints, and if you had any health problems, you know, during your training, if you had COVID, if your training was impaired, by COVID, maybe you were not able to do a particular placement, or your practice, if you think you weren't able to practice adequately because of COVID or because of a health issue, you need to add that in that form, okay, that form R. Then your BLS needs to be updated every year. You need to do a live BLS, not just a virtual one. You have to participate, update your basic life support skills every year. Safeguarding children, you need to do something on children safeguarding every year. It could be a CPD, something you've read. It could be doing a refresher course on children safeguarding level 3. It could be you being involved in initiating or being part of a child safeguarding, either a child safeguarding meeting or actually like a child safeguarding discussion, like, you know, a seminar, or an actual child safeguarding process for a child. Same thing as adult safeguarding. Every year you need to do something on adult safeguarding. Add it to your portfolio and link it. Don't forget, sometimes you can do these things, you can reflect on it, but if you don't link it, so you can link a clinical case review or a CPD to any of these, okay? And this just shows your exam. So your AKT, I was able to pass the AKT, so it's there on your portfolio. If you do the RCA or CSA, depending on what is going to be at your time, it also shows there. Multi-source feedback. So this is patient feedback, which I will do in ST3. So I haven't bothered with doing patient feedback. And colleague feedback, you need to do one colleague feedback every year. So in ST1, you do one, ST2, you do one, ST3, you do one, okay? That's that. We've come to the end of this portfolio review. So this is something I believe should be helpful for people who are just starting off, you know, the GP training, the ST1s, who may feel quite inundated and a bit confused, you know, not knowing exactly what is expected of them. So I just hope you work closely with your educational and clinical supervisors and also your friends, because I find that so many trainees actually learn a lot from, you know, from their peers by asking your friends, either at the same level or people that are ahead of you or who have completed training, how they were able to maneuver, you know, maneuver their portfolio entries to ensure that they were able to progress satisfactorily. So don't rely solely on your supervisors, because to be honest, your supervisors are very busy. Some of those supervisors are supervisors to many trainees, not just you, and they have their families, they have their personal work, so they're very busy. The only contact your supervisor might have with you is just to sign off your portfolio. But the actual process of learning the nitty-gritty of portfolio entries might be from friends and colleagues, okay? So thank you for your audience, and I hope this video, you know, gives you something really valuable. Thank you very much.